Hello. Let us now study about the bone clavicle. This is a clavicle or collar bone. We will study this bone under these headings. If you read under these headings, it is almost complete for you. And the first heading is peculiarities. What are the peculiarities of the clavicle? This clavicle have number of peculiarities. Number 1, it is the only long bone lying horizontally in the body. All other long bones are placed vertically in the body. This is a long bone which is placed horizontally in the body. Number 1. Number 2, it have two primary centers of ossification. Any long bone have one primary center of ossification. This is having two primary centers of ossification. Number 3, it is the first bone to ossify in the body. Number 4, it ossifies entirely in membranes. Number 5, it is subcutaneous throughout. That is why it is palpable. It is subcutaneous throughout, hence it can be made palpable. Number 6, it does not have medullary cavity. And number 7, it may be pierced by a cutaneous nerve, and that cutaneous nerve, when it is piercing, and that nerve is intermediate branch of supraclavicular nerve. So these are the 7 peculiarities of the clavicle. Side determination. How to determine the side? The end which is wider or quadrangular should be medial, or the end which is flattened should be lateral. The shaft, 2/3 of the shaft is convex, medial 2/3 of the shaft is convex forwards like this, and lateral 1/3 is concave forwards, and the inferior surface of the bone is rough. It is rough because of the presence of the subclavian groove, nutrient foramen, conoid tubercle, trapezoid ridge. All these things makes the inferior surface rough. With this, I can say that this bone which I am holding belongs to right side. Okay. So side determination is over. Now coming to the joints it is making. So it definitely have two ends. So it should make two joints. So medial end, it should articulate with clavicular notch of sternum to form sternoclavicular joint, a saddle type of synovial joint. Lateral end is flattened, which is acromial end, which articulates with the acromion process of the scapula to form acromioclavicular joint, a plain type of synovial joint. This is saddle type, this is plain type of synovial joint. So joints it is making, you came to know. Muscles attached, just remember few muscles, I think 5 or 6 muscles are attached to this. What are they? Medial 2/3 of the anterior surface, it gives origin to pectoralis major. Superior surface, the medial 1/3, it gives origin to sternocleidomastoid muscle. Anterior border on its lateral 1/3, here it is the origin of the clavicular fibers of deltoid. Posterior border lateral 1/3, it is the insertion of trapezius, and posterior surface medial 1/3 sternohyoid muscle, and last one here on the inferior surface there is a groove called subclavian groove which receives the attachment of the subclavius. So totally if you remember these 6 muscles, I repeat, medial 2/3 of the anterior surface pectoralis major, medial 1/3 of the superior surface sternocleidomastoid, medial 1/3 of the posterior surface sternohyoid, lateral 1/3 of the anterior border deltoid origin, lateral 1/3 posterior border insertion of trapezius. On the inferior surface there is a subclavian groove that is meant for subclavius. So these are the 6 muscles which you need to remember. Then ligaments related to it. The ligaments related to it are along the medial end, interclavicular ligament. This medial end, it is limited by fibrous capsule, and it gives attachment to interclavicular ligament, which passes through the suprasternal space of buns and connects with the medial end of the opposite sided clavicle. And it also gives, inferior surface gives attachment to costoclavicular ligament also. Along the inferior surface, the lateral end, you find one elevation called, this one is conoid tubercle, and by the side of it there is a trapezoid ridge. This gives attachment to the conoid and trapezoid part of coracoclavicular ligaments. So, you need to remember the interclavicular ligament, costoclavicular ligament, coracoclavicular ligament. So, these are the ligaments which are in relation to clavicle. Then nutrient artery, you find a nutrient foramen below, this is a nutrient foramen, and the nutrient artery is clavicular branch of thoracoacromial artery or even sometimes subscapular artery. So, most of the times it is clavicular branch of thoracoacromial artery is the nutrient artery here. And the last one, clinical aspects, where exactly it is commonly fractured. So, when there is a fall on the outstretched hand, definitely the junction between the medial 2/3 and the lateral 1/3 is the commonest site of fracture, because it is a meeting point of two different curvatures. So, definitely it is subjected to more stress when there is a fall on the outstretched hand, and it is commonly subjected to fracture. When the fracture is complete, because of the weight of the upper limb, this lateral displaced fragment may be lifted upwards and the union becomes bit delayed, and the treatment is usually the bandage of figure of 8 bandage is applied. So, this is all about the clavicle in brief. Thank you.